Hi everyone, my name is Dr. Mike Gorman. I wanted to talk today a little bit about chronic low back pain. Most people have heard when it comes to neck pain, back pain, that chiropractic is good at this stage of, everybody talks about chiropractic and it's pretty well known for that. What I wanted to dedicate the next few minutes to is some things you may not be as familiar with that can contribute or cause low back pain, just to give you an idea, a little bit more of our in-depth, holistic, comprehensive approach. It's a little bit more in-depth to trying to figure out all the different causes. We like to say that all health problems, no matter what they are, there are physical causes, there are nutritional or biochemical causes, and then there are stress causes. Everybody knows how stress impacts everything. And so when it comes to low back pain, certainly if you've got a misalignment in your spine, in chiropractic we call that a chiropractic subluxation. It's a fancy word for a misalignment. As that nerve gets pinched, it can actually cause some pretty significant pain. Most of you have even heard of the concept or the term sciatica, and that's where the sciatic nerve actually gets pinched in the low back, and it actually can affect the nerve coming all the way down the leg. So the sciatic nerve can get pinched in the back. It could technically get pinched as it goes through part of your butt muscle here called your piriformis. It can get pinched as it goes around the hip, and then even as it comes down the leg, behind the knee and behind the ankle, and cause problems further down the line in the legs or shin splints or other plantar fasciitis, things like that. But when it comes to low back pain, we get great results with that by working on realigning, taking the pressure off the nerve, and also working on some of those tight muscles or imbalanced muscles that can contribute and pinch that nerve on its way down. What I want to talk about are a couple other things that are really common. Matter of fact, I hardly ever see someone without it. One of the concepts is dehydration. In our test, we routinely do a urinalysis test on every new patient and anybody with low back pain after that. And the reason we do that is because there's a number of tests I want to get a gauge on, and we look at different tests and what they mean. But in the low back, if you're dehydrated or the urine has things in it like protein or other things that shouldn't be there, it tells us your kidneys are malfunctioning. Then if we don't address the kidneys, that's referring pain to the low back, and that's a really common cause. Matter of fact, if you take the average person with a holistic approach with chronic low back pain, and it's 8 out of 10, 2 of those might be the pinched nerve, 2 of them might be the fact that they have flat feet, and when they walk a lot, it hurts their back. 2 out of the 10 of their pain could be they're dehydrated and it just stresses the kidney and it causes low back pain. 1 or 2 of that could be a bladder, a mild urinary tract infection or a bladder infection, things like that. Or really common in the low back are digestive issues. So everybody knows the American diet is not that good. We're eating on the run, we're eating fast. As we don't digest our food properly or eat things that aren't that great for us, they tend to get half digested. By the time they get to our small and our large intestine, it starts to wreak havoc. And not only do we get gas, bloating, and things like that, but it will start to affect the nerves that go to the intestines, which are the same nerves in the low back. So a real common cause, aside from dehydration, of low back pain, especially chronic and nagging stuff, are digestive imbalances or digestive complaints. These are all things that we're experts in evaluating, addressing, and treating naturally, and then advising you on what things should you be eating, not eating, doing, and not doing in your lifestyle, so that we can then get that chronic low back pain to actually subside, and subside for good, instead of it being this like surprise that just takes you by storm, comes out of nowhere every once in a while. So to wrap up, there is like with everything we do, there's a holistic approach to low back pain and chronic low back pain in particular. And so we look at the nerves, but we also look at all the different organs and different things. We look at stress factors and things like that. And interestingly enough, probably the top 4 or 5 worst low back cases I've seen, where they've been everywhere and tried everything, those cases, the problem is actually coming from their neck. So your brain's up here, all the nerves in your low back have to pass through your neck on their way down to the low back. So if you've got a lot of tension or a lot of issues with your neck, A lot of doctors don't look up there because they're only looking with tunnel vision where they think the problem is, but we want to look above it, below it, physically, feet, knees, hips, sometimes people that need a hip replacement or they just have a lot of hip bone on bone, they've got chronic back pain, but we're not looking at the hips. We want to look above, we want to look at the neck and the TMJ and the jaw and things like that can affect the nerves coming down. And then we want to look at all those different types of referred pain that I mentioned. So with that, our whole approach with everything, but especially with low back, is to look at all the different things that we can, physically, nutritionally, and stress, and try to evaluate those so we can get you the best results in the shortest period of time.